Hi everyone, I'm part of the assessing team here at Autistic Women, and today I'm going to talk you through a little bit about our screening call process and why an assessment might be good for you at this time. So to start off with, just to see if an assessment is right for you at this point, I'm going to talk you through a little bit about what we might look for in terms of autistic traits. So to start with, obviously everybody's experiences will be very different in terms of autism and ADHD. But in terms of social communication, what we might see and what we tend to see is a lot of women coming through our service who can present as really socially confident, but actually underneath that, there's a lot of masking going on. And autistic women, we really like to look a bit deeper and what's going on for you in terms of social interactions. So it might be that that person that looks really socially comfortable and confident is actually really uncomfortable in that situation. So they might be analyzing all of their social communication. They might be scripting ahead of time so that they know exactly what they're going to say. They might have stock phrases of how to kind of start and end a conversation. They might be assessing and analysing their own nonverbal communication or others' nonverbal communication. So when we look at friendships and relationships, obviously contrary to popular belief, there's a lot of autistic people who are very, very sociable and have really good friendships. And that's something that tends to put quite a lot of people off coming for an assessment because they have really good friendships and relationships. What we tend to find is that those people will have more comfort when communicating with other neurodivergent people. So their friendships work really nicely because other people are quite similar to them, communicate in similar ways. And sometimes the communication breakdowns occur kind of when different neurotypes are interacting. Um, Many of us struggle to initiate and maintain friendships, and a lot of us have experienced trauma in relation to that. So there's a lot of isolation and bullying that many autistic people can experience as well. And there's so many of us that really enjoy and have a lot of connection from low maintenance friendships. So people that don't need us to check in regularly, people that are quite happy to see us every now and again, and don't need that kind of constant back and forth. So stimming can look really different across different people, but some of the more kind of stereotyped autistic stimming that we see is things like hand flapping, walking on tiptoes, kind of bouncing up and down on seat. Um, but then there's also a lot of more subtle stimming. So things like finger tapping, it can be finger wiggling, it can be things like rotating wrists a lot, or holding your wrists or your hands at unusual angles. It can be things like biting the inside of your cheeks, enjoying really crunchy textures, so things like crisps. It can be playing with your hair, twirling your hair, playing with jewelry, anything basically that brings you a lot of comfort, or helps to regulate emotions, regulate attention. Routines are often a really big part of the autistic experience as well. They can provide a lot of comfort and a lot of safety in that predictability. With changes to routines, it doesn't always have to be a big emotional response to that change. Our ability to kind of cope with change massively depends on our emotional regulation and what's going on generally in our lives. But sometimes change can create meltdowns. So really big meltdowns, really big emotional responses. Other times it can be very internalized. It can feel uncomfortable, maybe not distressing, but uncomfortable. With routines, it can look really, really different again across different people. We spoke to many women who really enjoy the repetition of watching the same TV programs, rereading the same books, kind of having the same experiences day in, day out. So walking the dog in the same route. Or one of the things for me is definitely around safe foods. So eating the same foods for breakfast every day, for lunch every day, and having predictable foods that I can rely on that bring me comfort. Um, Changes to routine can definitely be very destabilizing for a lot of us. So I liken it a lot to kind of being on a little bit of a wobble board, and nothing quite feels stable. For some people, it can be extremely discombobulating. So things like a change of setting, going on holiday, it always takes me and so many of the women that I've spoken to a long time to settle in once you get on holiday. So like 4 days in, finally feeling settled and comfortable, and then the transition back home is really difficult. I think my favourite part of the assessment process is talking to women about their interests. I personally learn a lot from them and the knowledge that they have in terms of their special interests. And just hearing the passion that comes through for a lot of our women is such a lovely thing to be part of. Um, it doesn't necessarily have to be things that are considered unusual in terms of interests. It can be things like, favorite TV shows. It can be, bands, people in their lives. And a lot of the time that's not really seen as an intense interest. But we're really interested in diving a little bit deeper, and we want to know exactly how intense that interest is. It might be that lots of people have the same thing that they enjoy. But really what we're looking for is how much time you would spend invested in your interests. A lot of the time it's around hyperfocus, and how sometimes it feels like two magnets in your brain are being pulled apart when you're having to transition your attention from your interest to something else. Sometimes that hyperfocus can be for such a long period of time that you forget to eat and drink, and everything else around you doesn't feel to exist. And we also look at sensory preferences as well as part of the assessment. So we're not just looking at sensory sensitivity, we're also looking at the sensory joy that we experience. So for me, there's nothing better than having pressure therapy from my assistance dog, him sitting on my chest or my knee, and providing that pressure is something that brings a lot of joy. And it's so lovely to hear about not just, the difficult aspects of being very sensitive to the sensory environment, but also the joy that that can bring for a lot of people. When we look at sensory sensitivity, a lot of the women that we speak to don't recognize some of the sensory sensitivities that they have, because they think it's a universal experience. So I spent a lot of my life thinking that other people had the same stress response to an ambulance going past and hearing the siren. I thought, everybody got really irritable by the feeling of someone, brushing up against you in a queue or moving past you on public transport. And actually, a lot of women will explain this kind of baseline irritation, and feeling really easily irritable. And then we look at ADHD. So ADHD is split up into three different presentations. So there's an inattentive type, a combined type, and a hyperactive impulsive type. So it's really interesting to look into the different types of ADHD, because a lot of ADHD can be missed by people maybe not resonating with the hyperactivity side, or people not resonating with the inattention side. When we look at ADHD, we are really interested in masking as part of this, our service. So for many ADHD women, it can look like a really organized work life, but really messy home, disorganized calendars at home, and using lots of supportive strategies to help manage daily life. So, being very reliant on calendars, needing to take your diary everywhere, having to write everything down, having reminders on your phone a lot of the time to kind of keep your organization in check. When we think about hyperactivity, especially as women, we tend to be socialized to be still. And so we're not just looking about how much you need to move around. We're looking about your levels of discomfort should you have to remain sitting for long periods of time. Are you making excuses to go to the toilet a lot, to volunteering for jobs in the classroom when you were younger? So we're really looking at underneath the layers there. At Autistic Women, we have a huge interest and knowledge base in the overlap in autism and ADHD. So when we look at our assessments, we don't assess the two separately, we assess them together. So they're both the same clinician, just both assessments. And the reason that we like to do this is because there's so many overlaps and there's so many contrasts between the two. So, for example, many women will report to us almost like a feeling of a tug of war in their brain. So, they're having lots of needs, drives, and preferences from two different directions. And that's really common for a lot of ADHDers. So, the mixture of the two, autism and ADHD. And that might look like things like loving routine and structure, but also needing a lot of novelty for stimulation. And that can mean it can be really hard to stay in a routine. It can also be things like seeking out a lot of sensory stimulation, but also feeling very overwhelmed by that. So, a really good example of this would be when I would go night clubbing. So, from an ADHD perspective, the level of sensory stimulation was brilliant. It did a lot for my ADHD. But then later on, I would have a massive come down from that because I was so overwhelmed in my sensory system as an autistic person. Something that we also touch on in our assessment process is screening for PDA, so pervasive drive for autonomy, also known as pathological demand avoidance. So our assessment service is really, we really prioritise looking at PDA from a non-pathologizing perspective. We really want to understand the drive for autonomy in a really neuroaffirming way. A question that we really commonly get asked at screening calls is when's the best time to look at an assessment? And our answer is always based on individuality. But generally, the thing that we suggest is being in as good a place as you can do for the assessment process. Obviously, that can't always be the case, but we always suggest being in a good place for accessing the assessment in mental health, in general well-being, for the reason that our assessment is very in-depth. So we go into a lot of detail, we unpack life experiences, and especially if people have experienced trauma in their life, that's something that, might reopen some old wounds. So that's why we suggest that it's good to kind of be in a stable position. We also suggest having good supports in place around the assessment process. So that can be things like having a really good therapist that you're able to discuss things with and help you to process through the assessment process. And also having a supportive network around you. Obviously, we know that's not always the case, and we will do our best to support you through everything. But that's one of our recommendations. Personally, through having an assessment myself and understanding my autistic ADHD identity, that's been really life-changing for me. So I had collected labels throughout my life of, things like being really difficult or being highly strung, having all these really unhelpful labels. Whereas actually, I'm autistic, I have ADHD, and having the vocabulary for that allowed a lot of self-compassion and a lot of self-acceptance and enabled me to do a lot more self-advocacy. So, what can you expect from the assessment process? So, the way that we do things at Autistic Women is that we are very, very in depth. So, we really do leave no stone unturned. We like to explore things at a deeper level to get to know you as a person and to be able to understand you more holistically. And as part of that, we really aren't reliant on standardized measures. So we might use questionnaires, we might use standardized measures of looking at autism and ADHD, but that's not our sole focus. Our sole focus is learning about your experiences from you. So what we find is a lot of assessment processes that look at observational tools, just look at what's on the surface. And we know that for so many people, autism and ADHD can be highly masked. And so we're looking underneath the layers there. We also use a very compassionate, trauma-informed and neuroaffirming approach to our assessments. We don't pathologize. We very much use neuroaffirming language and work from a strengths-based approach during our whole process, including the reports. Our timescales for looking at assessment, once you book in, we can get people in for a first appointment remotely between 4 and 6 weeks. And for in-person appointments, we look more at 8 to 10 weeks. So, with the assessment process, the length of that can sometimes vary dependent on complicating factors. But generally, from the first appointment to the report, we look at 4 to 6 weeks. The first step for starting the assessment process is to book a call with us today. So, at your screening call, we will run through the traits that you're experiencing in the criterias that I described at the start of this video. Um, um, there's no pressure on you to provide that information. We will very much ask the right questions. We will guide you through. So a lot of people will ask us, what do I need to plan for the first session? But we don't need you to plan anything. Just bring yourself and your mind, and we will do the hard work through that bit. Although I have talked about women as a term throughout this video, we're also inclusive of trans women and non-binary people through the assessment process, and we work hard to ensure gender affirming care. If this approach sounds like the right one for you, then you can book a screening call with us today, and we really look forward to working with you.